Yeah, the delays. Well, in August, I'm just going to go back there briefly, quickly, get it so we can get it out straight. My doctor Beveridge had sent me for a X-ray because I've been tired and what not. So during that X-ray, found something irregular. So he did a CT scan here in town and found that I had cancer on my right upper lobe.
Okay.
So, being Beveridge, he was quick on the gun. Had me up in Winnipeg in a couple of days to see Dr. Unruh.
Mm-hmm.
Dr. Unruh said, this is another thing about Winnipeg too. I got up to Winnipeg and I was in the office. I wasn't there 20 minutes. I was in his room. I've seen another doctor already. Unruh came in and said, yes, we looked at the CT scan, you do have cancer. He's very blunt and forward, which I really like.
Okay.
And he sent me for blood work right away. They had to do it at the wrist to get the pulse. Had a pulse. They have main vein, main artery.
Okay.
And I did a breathing exam, which is quite extensive. It takes a while, about an hour or 2 hours, something like that. And chest or a heart.
So you're breathing, that's to see what volume you have left, or what capacity you have left?
What capacity I would have left. I mean, you push it as hard as you can up, and you push it down, and you got to breathe through this machine. It's almost passed out, but it worked. Anyways, after that, they said they'd get back to me because they had to arrange things. But they were like, I want to do it now. So I hadn't heard anything in 2 weeks. So being curious, cancer kind of makes you a little nervous, right? So I called Winnipeg and said, well, we're still waiting to hear from Ontario. So I was confused because I said, what's what Ontario got to do with it? I says, well, they're squabbling. This is secretary. I said, they're squabbling between Ontario and Manitoba now because they put these machines that are very expensive. It's a PET scan, which are very expensive. They put one in Thunder Bay for all Northern Ontario. And as everybody in this town knows, Thunder Bay is the end of Ontario, if that far. So, make a long story short after this, I haven't heard anything till yesterday from Ontario. Now I don't know if Sarah Campbell had been able to do something or if it was my doctor, but I know my doctor went ballistic here about 3 days ago because he had no idea that this had to go to Thunder Bay. So since August the 28th till this date, I have now a date on the 17th at 10:30 in the morning. I got to be there to be prepped. No way done in Winnipeg. Okay, so I'm going to go down there, drive all the way down there, have this scan done. I have to stay a night in a hotel room. My wife has to take time off work.
To drive you.
To go with me.
Yeah.
Well, I want her there for sure, right?
Mm-hmm.
So, in the meantime, I got this call from Winnipeg. Before I actually just gotten up because I was looking at my phone. I had a voicemail, so I knew somebody was calling me for this. And it was Chris from Thunder Bay telling me I had an appointment on the 17th at 10:30 in the morning. And then I got a call from Winnipeg saying, bring that scan to us the next day. So here I've, since August the 28th to now, I've been waiting to get the scan. Now I got the scan, I go into Winnipeg the next day. And I want to know who is delaying this. It's not reasonable to talk price here because there's no price. They're charging you to go down there. It's not money orientated. It's political. You've got people down there saying this is the way we're doing it. And they're going to fork over the money for me to do that and then come back here and then fork over more money for me to go to Winnipeg to take that scan up. Where's the sense in that? Mine's been settled, but I'm hoping that somebody can do something for us up here. Winnipeg is right there. I won't even put in a travel grant lots of times just to go up to Winnipeg. We'll go up there, do what I got to do. I've been up there before for surgeries. And I don't mind, I'll go up to Winnipeg and stay today. I never send a bill to them.
In the meantime, you're not able to work, I understand, at this point?
I'm retired,
Okay.
so it's not,
Okay.
but that's not the issue. And when you're retired, you're on a fixed income too. I don't know what the other people are like in this part of the country, but imagine people in Red Lake. That's even further.
You're wondering if this is a change in policy, if you're hearing from other people about having to change their treatment plans.
Well, this, I understand, I'm hearing that this is just a new policy as of June or something they started.
Okay.
I can't verify that real good, but I'm just hearing that, yeah, in June something happened.